Gauteng Premier David Makhura says he's concerned about the increase in COVID-19 hospitalizations in the province. Makhura says more than 2,800 patients are currently being admitted at both public and private hospitals. The province is also the COVID-19 hotspot with more than 446,000 cases. Makhura was giving an update on Gauteng's response to the coronavirus a little bit earlier today.
We are tremendously concerned about the increases in the hospital admissions. So increase in the number of daily cases and the weekly average is one concern. The second concern is the increase in the number of hospital admissions. As you would have seen by now, as we speak now, 2,866 patients have been admitted in Gauteng hospitals, both public and private. So what happens with the hospital admissions is a matter of great concern. It tells us the story. What's the difference between 1 week and the next? And what does this do to our capacity?
Tshwane, Johannesburg and Ekurhuleni are among the COVID-19 hotspots in Gauteng.
When you get to 3,000 daily cases, you must be worried about the peak. You must be worried about the momentum. You must be worried also about the pace of actual the pandemic itself. But you also have to be worried about the increase in the number of hotspots. Professor Melado also showed us where these hotspots are. So obviously there was a week where we were more concerned. 3 weeks ago we were more concerned that the pandemic is in Sidibeng in the south. 3 weeks ago. 3 weeks later the pandemic is not only in Sidibeng, it's in Johannesburg, it's in Ekurhuleni, it's in Tshwane. So those hotspots have now moved just from Mfuleni, and then they have also moved to parts of the West Rand. 3 weeks ago, the pandemic was literally, the fire was not there in the West Rand. And we were there with the MEC for Health and the MEC for Infrastructure. 3 weeks ago, we were opening the hospital, Anglo Gold, Ashanti. The infection levels in the West Rand were very, very low.